So just when you thought that we've turned the page on COVID and put behind us, there is now a new variant experts say may be tougher to detect.
Dr. Eric Ascher is family medicine physician with Northwell Lenox Hill Hospital. Hello, nice to have you here.
Good morning.
You're looking at two people with lots of antibodies.
Yes.
What do we know about the virus this year? Because for me, I got it like in 2 seconds. I was infected by someone who lives in my house. Who's not taking the blame for it, but 2 days I got it. Is it more contagious this?
Absolutely. So with this variant, we're seeing that it's a lot more transmissible, a lot more contagious. The interesting fact about this variant is that it has a lot more mutations on it than prior ones. The good news is symptoms are still the same, disease course is still the same amount of time, and we know that the current vaccine, which is our best line of defense, is protecting against this current strain.
Oh, this new variant, that's good. But I'm also hearing that it's harder to detect. Like if you take those home tests, they may not exactly be accurate. Are you hearing that as well?
We're hearing that a lot of folks are having to test and retest. Sometimes it could be testing error. Sometimes folks are not putting the swab up high enough in the nose. So we know that if folks do have symptoms, the best thing to do is stay masked, avoid going out, and keep testing, especially if your symptoms are getting worse.
So here's the issue that I think we both kind of went through with COVID recently, is that as soon as you start feeling sick, we're like, got a test, give me a test, give me a test. And it's showing negative until your viral load hits like optimum amount, then it's going to show positive. So what should people be doing then? Because I mean, at first we're like, tested negative, and you go about your day and you don't think you have COVID, but you're spreading it around to everyone.
Absolutely, and we're seeing that a lot in my office, especially in this past week. So really, really important to avoid going out if possible, staying masked because that's the best line of defense aside from vaccination, and not forgetting the things that we've learned through this entire pandemic, hand washing, hand sanitizer, and things of that sort.
So what's the course of action then? So once you feel sick, at what day do you think that you'll show positive if you do have COVID on one of these at-home tests? Should we just throw them out? Because at this point, you might as well just go get a PCR test because that is more sensitive and more accurate.
Absolutely. The PCR test is still the best test to have. The convenience of the at-home test is something that the PCR just doesn't have. So best to test at home if you have access to that test. Still not feeling well, stay masked. Call your doctor, see if they could coordinate a PCR for you. And if they can't, test still at home, because that at-home test, once your viral load is high enough, which is when you'd be contagious to others.
At what day is your viral load the highest?
So everybody's a little bit different. We're expecting within a day or two, your viral load should be high enough to detect at that
a day or two
test.
After you start symptoms?
Yeah.
Okay.
Can we talk a little bit about the flu? Because the governor was talking about it yesterday. She's concerned flu cases are on the rise. What are you seeing at the hospital?
We're seeing a lot more flu, both in the hospital and in my ambulatory practice. You know, with holiday time, we expect a lot more gatherings, a lot more travel, a lot of folks hanging out indoors. So there's a breeding ground for flu and viruses. So we have seen this increase. Vaccine, best line of defense, and we're very fortunate this year that the vaccine has very good coverage for the most common circulating strains.
That's good news. Now, I know a lot of people, some people run to the hospital to get checked out. I'm hearing that a lot of the emergency rooms in New York City are filled with migrants, and lots of people who also need help can't get in the door because it's filled with migrants. What are you seeing and hearing?
We're seeing that our hospitals are getting an increase in volume with all different viruses.
Would you say they're stretched?
I don't think we're there yet. I think fortunately we learned a lot in 2020, so we know how to prepare. So we're not at that stretched mark yet, and I don't think, I'm very optimistic that we're not going to get to that point. But I know that if we do, we have the precautions that are necessary. And
just like for basic protocols, if you have the flu or the virus, once you start feeling symptoms, at what day number can you go out and mingle with people that you're like, no, I'm not contagious anymore? What day is that? I just need to know, because if I get sick again.
It's too late for you.
Well, it is too late because I have to stay home for almost 10 days.
I know, me too.
And that's the thing. Is that the protocol? Is it 10 days you got to be home still, or no?
So with COVID, it's that first 5 days you're at home, you're avoiding other folks, and then from day 6 to 10, you're able to go outdoors as long as you're masked. So you're not going to want to go into a social setting like a bar or a restaurant, but if you need go to get your groceries, as long as you're masked, you're considered okay. Day 11, if you're not having any fevers, is when you're back to
Hold
normal.
on. That's a lot.
It's a long time. It's a long
You've been
time.
freed. Look at you. And you got all the antibodies.
I'm just saying, but I bet you this is going to happen to us again next year. Are we really going to wait 11 days so we can socialize?
I think they're going to change the protocol.
I'm hopeful. The more folks that do get ill, hopefully, the less time that we'll have to quarantine.
All right, Dr. Ascher, how can people find you?
So my Instagram handle is at Dr. Eric Ascher, and I work ambulatory at Lenox Hill Hospital.
Can
Thank
we DM you if we get COVID again?
Please, I'd be happy to help.
We may need the get out of jail pass.
Seriously.
All right.